Well, I usually get pain, but when I go into hospital, nobody thinks I've got pain.
My name is Bola Jibodu. I'm 43 years old. I'm married. I'm blessed with 2 beautiful daughters. And I was diagnosed with sickle cell as early as 10 months old.
Who am I? A man of integrity and honesty. That's who I am.
Sickle cell is seen as a niche illness, quote unquote, that only affects a particular group of people, predominantly black.
When we first heard of it in the West Indies, it was like a time bomb for people who got it. You can't pass certain age.
I think when I was younger, at one point in my life, I had one of the highest sickle cell counts in like the whole of the UK. My dad always tells me.
I feel like it's a choice to be broken. So I can't every single time leave the hospital and just wallow and do nothing about it and just constantly use the excuse of, oh, I was in hospital, when I can really and truly just try and pick up from where I left off. And then that puts me in a much better space than if I was to just sit at home and just...
I'm a father, brother, son, husband, friend, a sickle cell warrior, and just a very aspirational individual.
Sickle cell has always struggled to get people's attention, to keep people's attention, and for patients such as myself to be treated as equals.
Welcome back to the Primrose Files. This one is about sickle cell. We have been busy talking to people about their own lived experiences. And in part 1 of this 2-part series, we will tackle questions such as, how is the sickle cell experience different for people aged 3 to 83? We will hear from Auntie Tina. She's 83 years old, almost 84. She's Bristol's first diagnosed sickle cell patient. How about the parents of 3-year-old Isaiah? We hear a myriad of stories that could reshape the way we all look at sickle cell. Here we go.
What makes me a sickle cell warrior?
Would I call myself a sickle cell warrior or a sickle cell patient? I think I would identify with both.
The Sickle Cell Society has a long history, so it's nearly 50 years old, and it was one of the first sickle cell charities to be established.
Until I was 40, I had never met anybody who was in their 50s or 60s.
I know it was in the summer of 1962. I had a crisis and I was taken into Southmead Hospital. This doctor, he works in Africa, and he was the one that diagnosed that I had sickle cell. We didn't know what it was, so he had to explain all that to me.
The late 60s and 70s weren't that long ago for somebody of my generation, but in those days, doctors, nurses had little or no information about how to manage and treat people living with sickle cell. And the Sickle Cell Society arose from the voice of parents who had young children with sickle cell in those days, healthcare professionals who felt that They needed to do better and understand how to care for the community and other people. So back in those days, Dame Elizabeth Anionu was the first sickle cell specialist nurse. She was one of the founders. Dr. Brofozic, who was at Central Middlesex Hospital at the time, was one of the supporters and founders. So we have a great history of supporting people with sickle cell over those years.
Yeah, from pregnancy it was a shocker, and because of finding out at say just over my first trimester, it was a short span to decide what I wanted to do, if I wanted to continue with the pregnancy or terminate. It wasn't really a decision to think about. I just decided, well, whichever way it happens or how it happens, then yeah, he's gonna be here.
From the hospital I went to as a child to the hospital I go to now, there's a group of patients. We all grew up together. Quite a big group, actually. There are only 3 of us left.
How much do people really know about sickle cell? Even people who live with the condition, what were they told? How frightening was this information? What about parents of children who are just being diagnosed? How do they process a sickle cell diagnosis at such a happy time in their lives?
So what I understand about sickle cell, and with both my daughters, is I mean, when they were first diagnosed, or they told me about the diagnosis, they said, you know, there's different types of sickle cell. Usually those that have SC aren't likely to have blood transfusions, but they can still have, you know, very serious sickle cell crisis.
I've been a warrior, I've been a fighter from when I was 10 months old. And from that time, they would tell my parents all sorts of things that, okay, she can't do this, she can't do that, which were facts. And early childhood was really, really difficult.
I've been told more times than I care to mention that I won't live to this age, I won't live to that age, I'll be dead in this, and blah, 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 on and on. So at age 18, 19, I said, I don't care.
Because when I was young and discovered that I had sickle cell, they told me I wouldn't live past 30. And I was told not to have any children. But I've got 2 lovely ladies.
We were taught that it's a sickness that people can't pass a certain age. When you got it, if you got it full blow or full-fledged, they say you can't pass like 20, 21 or something like that. Mm-hmm. So that was a scary thing for people to hear that they got it.
It can be deemed frightening when you're faced with the unknown, because you don't know what to expect. You might be told this will happen, that will happen, but when you're with the unknown, it can kind of make you go in that separate lane. But it's now and again, me and Denton will have conversations, and I'll be the one that doubts a little bit, because I think that maternal mother thing comes in. But he'll be the positive one and say, no, you see him healthy and he's doing well, and give him this and give him that. So to help aid his growth.
They didn't think the girls would live, but they are alive. And the youngest, Saturday coming, she'll be 56.
Most sickle cell patients live with excruciating pain. Some will tell you it's every single day. How do they cope living with this pain almost every day of their lives? Always being in hospital, not understood too many times. Surely this must have some kind of mental impact.
Okay, so physically, obviously, I do tend to be in a lot of pain. I didn't really get mental effects until I was a teenager, but it can be very detrimental, especially if you're in there for a very long time. It can also impact my social life.
It was interesting to say the least when it comes to my interactions with other people and figuring out myself how to cope with the disorder. For example, the older I got, the more independence I got. The more independence I got, the more I had to figure out how to cope without my parents' help. So yeah, there's many times, for example, when I'll be out playing with friends and I'd suddenly have, let's say, a minor to a major crisis, and I'd have to just be like, yeah, guys, I got to charge this, I got to go home.
Sickle cell pain is classed as to be one of the most, or if not the most painful illness on the face of the earth. At its worst, it's akin to being set on fire. I know people who are women who are mothers and have given birth and have sickle cell. And they would rather give birth every day than have a single sickle cell crisis.
I experienced those pain only in crisis. Even the labor pain that I have to have my children wasn't as bad as how those pains were.
Imagine being in pain where you're crying and you don't know you're crying until a tear hits your arm or something like that. You actually just don't even know it's coming out. Your body's talking to you, you don't even know, because you're trying to internalize this earthquake that's happening inside you, you know something's happening, but you can't figure it out. And you're looking at someone for help and they're looking at you like, what do you want? Because they actually don't know.
Chanaya's got one leg shorter than the other, which has affected her hips. She had a recent crisis, admission in hospital, because she had pain down one side of her leg, which was really incredible. She couldn't walk, so I had to sort of take her to school with crutches so that she could, sort of still manage to get around school.
I remember the first time I went to hospital because of it was in 2022 summertime, and I didn't really know what was going on, so they had the physiotherapist coming in every day, and she measured my legs. She was like, "Oh, your legs are shorter by 1.5 centimeters." So obviously I was struggling to walk around, and now I've gotten used to it, but the pain started acting up again.
Until my daughter was 7, she didn't realise that I lived with her. And I had no idea. And it's the only thing in life I have guilt about. It's how it affects my children.
Yeah, it was difficult interacting with my age mates and trying to do the same as them. And that kind of, I would say, probably bred a bit of insecurities, anxieties, fearfulness of getting ill and not wanting to put myself in positions that my age mates were doing because I didn't want to get ill or embarrass myself.
I think I thought at some point I was going to be able to have children, and then I was thinking, oh, my children are probably going to have sickle cell as well, so it's best not to have any children. Thinking about that at a young age doesn't really make you feel any better than, you should do.
I'm being honest, my greatest emotion in life is anger, period. I remember when the Avengers film came out, and there's a scene in the film where Iron Man turned to the guy who's playing the Hulk and said, "Bruce, isn't it about time you change into the Hulk? Get angry." And as the camera panned and he slowly turned around and he said, "I'm always angry," and turned into the Hulk immediately. That's me. I'm always angry.
Pain stops people living with sickle cell from doing what they need to do. Would that make you angry? If you couldn't carry out simple things that you have planned on a daily basis because of the pain you are living in? Would you be frustrated if the spaces that you have gone to for care to make you better didn't quite understand what they need to do and when they need to do it? This is often the reality of people living with sickle cell.
And one thing that I was taught when she was born, was that I would have to try and have as much knowledge as possible about her condition so that, you know, if anything would happen, you know, that I'd be able to obviously speak up.
I know more about my illness than most physicians that look after me. I've lost count of the number of times I've sat on a bed with a medical book, explaining to a doctor that's supposed to be caring for me.
They're supporting you, but they don't know what they're doing. They're guiding you, but they don't know where they're going. They're listening to you, but they're not hearing you.
How we're treated impacts the funding and the way politicians treat us, the way people think of us generally. We are not thought of as people. We're thought of as a burden.
Many of these hospitals still don't know how to treat these patients. Yeah? Up to a couple of years ago, we lost 2 young men. One of these men had to call 999 from his bed because he couldn't get the treatment from the hospital.
It's really important that healthcare professionals listen to people who live with sickle cell. It's not a coincidence that our report that we produced in 2022 was called No One Is Listening, because the reality is that nobody was listening. And the consequence of no one's listening was A, the experience of people in A&E was poor because they're having to explain that it's okay to give me this level of morphine, or this is what I would normally get. So it's really, really important that the voice of patients and families is heard loud and clear.
I do believe that the lack of empathy is deliberate, I'll be honest with you. It just is. You know, if you're, you know, like with Hanaya, if you're hearing someone screaming in pain on the whole ward, there's other patients that are not very well, and there's someone screaming, and you're begging for the nurse to give the pain relief, and then she says, well, I'm not sure because it's morphine, and she's not comfortable to give that. Yeah, so sometimes it does feel deliberate, I'll be honest. You know, even if it's not, it's just happens so often that it's hard to tell, it's hard to differentiate what is deliberate and what isn't.
So what we do is when someone has come in and had a bad admission, we then ask them, will you be happy to come and join a teaching session? Because you can speak about that episode. And it's quite recent, so they can be quite emotive about it. And sometimes even, you know, 5-6 years later, people will still be able to speak about, you know, a traumatic episode in a way that it really does impact how clinicians respond.
I know how we're looked upon as difficult people, troublemakers, quote unquote junkies, who turn up to A&E just looking for drugs. I personally have never in my entire life met an addict who was a sickle cell patient. Not ever. And the scientific fact around that is the fact that because I am always in pain, it is almost impossible for me to become addicted to the morphine that I take daily. If I was in a lot of pain and I took morphine at a particular level, and the level of pain reduced, but I kept the same level of morphine intake, I can build up a tolerance to that morphine, as I would if I continue taking it over time. But because I'm always, and I mean always in pain, it is nearly impossible for me to become addicted.
The thing is, with teaching sessions, you can only capture the group in front of you. So what we're trying to do is develop tools that are then available for everyone to be able to see. So we've done all these patient videos. We've got one on being in pain, being heard, describing what the pain feels like. And we've got patients across the breadth. You know, we've got a 5-year-old, we've got a 12-year-old and an adult patient, and parents, all just describing what it is like to just come in with a pain and then not have the response you need. You know, from, you know, one of the most impactful things that parents said was, you know, taking a kid to a completely well child to a park, they're playing around, no problem at all. And then on the way home, they suddenly have pain in their leg, and then suddenly they're not able to walk. And then
instead of just having a day out in the park, you're in an ambulance going to a hospital. And as a parent, you're panicking because you've got kids in school you need to pick up. You've got the little one in front of you who's got pain that you want treated. And then you go into hospital and it feels like everyone is just walking past your bed and not doing what you need them to do, because actually all you need is your painkillers, a bit of rest, maybe a bit of hydration, and then this will be fine and you can go home. And it's trying to get that message across.
You should not be afraid to go to hospital. Every time I go to hospital, it's like a war mentality. People with sickle cell will tell you, you have this war mentality because you know you're going to have to do battle. That's why people think that we have an attitude.
I'm obviously on this side of it, so I'm aware of the work that is being done, you know, the education tools that are being put in place to try and make this better. And when you have a bad experience, it feels like things are not improving, but I promise they are. They are quite slowly. Everyone in healthcare wants to do the best by their patients. Everyone in healthcare is working in quite challenging circumstances, and nobody is looking to create harm. It is sometimes inadvertently happens, but the right, I think it feels to me, from what I see, from what I hear, from the various bodies, the funding that's coming in, that everyone is looking to do the right things and make care better.
Thank you. Great, thank you. Healthcare professionals have promised that they are implementing change to benefit the care of sickle cell patients. But what about the education sector? What are they doing with children in their care who live with sickle cell? What structures are being put in place from early years to university?
I'm an 18-year-old student. I go to Cotton.
To benefit the students that are in their care.
I think in primary school, I did feel very isolated, being the only one that I knew of in my class with a condition. Like, I'd have to stay inside because it's too cold. And then I could only have like a select amount of people with me when I was staying inside. So it was sort of hard to socialise with other people and make friends.
University is supposed to be like a self-led individual kind of experience to get to know yourself. But there were points where I did need support and I wouldn't have said I got it. When I signed on, I made the university aware that I had a disability, but throughout my whole time as a student, I don't think I actually had a single staff member from the disability area actually check in with me.
What I tend to do from birth all the way up until she's now in junior school is any childcare provider, I'd make sure that they have information about the sickle cell, like a whole plan of signs to look out for, you know, if there was any symptoms that she could be having a crisis, and making sure all the staff were aware. There was one time when she first started reception that I had someone come in from a charity to train at about 14 different staff so that they had an understanding, because they didn't know anything about sickle cell. So if anything happened, you know, it would be frightening for them, and then it could be quite challenging for her.
I feel like if I was to reach out to them, I would get a response, however long that took, but they were never like just asking, hey Khan, how you doing? I had rest breaks in exams, that counts as support. Yeah, like a scribe and a note taker and stuff like that, that counts as support. But human interaction, just a check-in kind of thing, I don't recall actually ever getting.
People who live with sickle cell have a number of stress factors in their lives every single day. Is it all doom and gloom for them? Or do they have moments where there's something that cheers them, something that excites them, or some breakthrough in treatment that they go, wow? What do they see in the future? Do they see things never changing? Or are they doing what they can to help make that change possible? They are warriors after all, and warriors don't often get down. There is always something to fight for.
I'm the first black woman to have an allotment down in Thingwell Park. So most of the men around They help me to fork my allotment. And they give me things to plant, and I buy quite a lot of things and plant them. Mainly for West Indian, I grow callaloo, red peas, all sorts, potatoes, all sorts of things that you know we use, I grow them.
I love to watch movies. Like, I just love watching movies or series. Or sometimes I even sing, just to get my mind off it. But yeah, these are the things that I like to do when I'm stressing.
And when I sing, it is the closest I get in life to being pain-free. For the time that I am singing and putting that rage somewhere, it is literally the closest I ever get to being pain-free.
I'm very encouraged that there are going to be ongoing workshops and things like that, so I'll do my best to attend as many of those as I can, because I think it's before you can spread a message, you need to fully understand it yourself. And even though I'm the age I am, I never stop learning. So just because you're over a certain age, you know, you never know who you might be able to help with the knowledge that you're gaining.
There's a bravery to speak up about it, because more people within the direct sickle cell community are being impacted, but are getting to positions of influence by which they can champion the message.
Just because you live with something that people can't see doesn't mean that you aren't seen. So don't feel like you need to keep quiet or hide because people can't see you.
My ideal world is that if someone is born like me, they don't have to be angry. They don't have to get up and think that they need to fight every single second of every day.
So that's why it's necessary to be a sickle cell warrior and not let the play on words allow you to just suffer with this, because it's easy to just feel sorry for yourself and, well, I can't get up today, or I can't this and I can't that, and have that approach, but I ain't achieved nothing yet.
In my family tree, there is a magic soaring through and all around. I'll always be found in my family tree. There is a light shining through, and in their eyes, it's in your smile.